Well, 18 local cases were reported on Tuesday, and only 5 of them had an unknown source of infection. The health minister said that most of the recent infection clusters had emerged from families.
He also noted that COVID cases have been getting younger. Last week, more than 40% of new cases were between 20 and 39 years old. Local governments have been instructed to ramp up COVID awareness among young adults.
Today, we have 18 local cases. 9 of them tested positive during isolation.
The CECC reported 4 deaths and 24 cases, including those from overseas. In a promising sign, only 5 of the cases had an unknown source of infection. But the CECC also noted that the cases were trending younger.
The cluster infections from the last 2 weeks have primarily been family clusters. The age of confirmed cases is going down. Local governments have been asked to promote key COVID guidelines among younger people and to strengthen safeguards against community transmission.
Between July 4th and July 10th, 28% of all cases were between 20 and 39 years old. But between July 11th and July 17th, the rate had risen to 43%. As of Tuesday, vaccine appointments can be made by people in the 6th, 8th, 9th, and 10th priority groups, as well as all adults 48 and older. About 1.7 million people can expect a text alert informing them that they can book their shot. But some younger adults say they've gotten text alerts too.
They are in the 9th priority group and don't know it. They may have been diagnosed with a designated condition but forgot about it.
So far in the vaccination campaign, 5.41 million doses have been administered for coverage of 22.48%. The third round of vaccination is set to start Friday as a typhoon makes its closest approach. The CECC says that if class and work are cancelled due to the storm, the local vaccine station will close up too. People who don't get a vaccine due to closures will be allowed to book again the next time appointments are available. The CECC also took questions on whether it will declare a reopening next week.
Right now, we do not want to reopen. We may downgrade the alert, but face masks, social distancing, and frequent hand washing are guidelines we will not change. If the COVID alert must be raised again, we will announce that. Once there is community spread, it is very difficult to go back down to 0 cases. There's a relatively low chance of that.
The CECC said that a greater easing of COVID rules is possible so long as the epidemic does not expand. It said it will work with local governments to form guidelines for loosening restrictions.